Hey guys, welcome to Live at 5 here at Valencia Medical Center. I'm Dr. Abraham and we have with us today Karissa.
Yes, my name is Karissa. I'm a nurse practitioner and I'm the new member of Valencia Medical Center.
We're very happy to have her. She's bringing a lot of experience with her, she's been doing, a lot of the stuff that we've been doing at a different location for a while, so we're very glad that you joined us, and we thought that would be a good opportunity to also introduce her to you guys, and as usual answer your questions, talk about some of the stuff that we do here: Botox fillers, cosmetics, PRP, joint injections, hormones, all that good stuff. So I know you guys had some questions that you've already sent us before that we can go through, and then again we'll talk about just it's gonna be kind of general, I guess, the topic this week.
Okay, sorry.
We have Cassie behind.
I'm here.
Behind the scenes. When you hear a voice and you don't see a face, that's Cassie.
Yes. So I don't know if you guys just sort of, want to sort of introduce yourselves. I mean, I guess maybe this is for Karissa, just kind of, why aesthetics, anti-aging, your favorite treatments, just rewards. I guess, doctor, we can ask you that as well after. But yeah, just a little bit about you guys.
All right, my name is Karissa. I've been a nurse for 14 years, but I switched to aesthetics because that's my passion. And I do Botox, fillers too, and PRP facials, or microneedling with PRP. And then also I'm doing joint injections. That's part of one of the services that we offer here at Valencia. So so those are the basic services that we offer here, and I do.
Awesome. Doctor, do you want to say anything? Just your favorite treatment? I don't know, just sort of your rewards, why you sort of like being in aesthetics or anti-aging?
Well, I love the variety of it all, so that's a good thing about offering so many treatments that are all related, but it's not it's good that we have so many treatments, so you're not doing the same thing every day. So I like to be able to go from pain relief with joint injections to like more anti-aging to some vitamin therapy, which we didn't talk as much about, but it's another thing that we both like to do and we both do here all the time, to doing things that are more cosmetic. I would say PRP in general, because there's so many things that you can do with PRP, is one of my favorite things, especially when we do joint treatments, for example, like knees, shoulders, elbows, tendonitis, all that stuff. That's probably one of my favorite treatments, and I always kind of bring up PRP, so I'm sure our followers have already heard me talk about PRP so many times before.
Awesome. Okay, so I feel like our theme, I guess, for tonight's sort of live is just for people that are sort of new to this anti-aging journey. What questions should they sort of be asking when they're sort of looking for injectors? Just maybe sort of kind of touch base. I know that products might be sort of a thing. Can you guys just sort of expand a little bit on maybe what types of products maybe, or placement of products?
Sure.
So for example, fillers. Well, that's very popular, okay? Because fillers has instant results. So, but there's a lot of patients who would ask, like, what is the specific filler that that we have to use for a specific area? So that's a very important question to ask the provider or the injector. And of course, we're here to explain that to you guys, or do the consultation before the actual procedure. So those are the basic, one of the things that you have to ask.
Exactly. Oh, go ahead.
Yeah, and also, of course, the common side effects of it, okay? Which is mainly swelling, redness, which will actually, that will get resolved in a few days. But then if you have swelling or redness that's lasting for more than 4 days, then of course call our office, and we can ask your questions about that.
Perfect. Yeah. No, and I agree 100%. I mean, in general, it's when you are new to these type of things, I guess one of the main things to start with is that you do want to come to the right kind of facility. You know, you want to be doing it at a place where there are providers who are experienced in that, who are, I mean, I can't believe I have to say that, but people who are licensed, who are, you know, working within their field, because unfortunately sometimes people are doing, you know, using products that aren't like necessarily like US licensed, for example. So you want to make sure you're coming to a right type of facility where you feel comfortable, where you feel like you can trust the staff, where there are, you know, providers like me or like Karissa over here, you know, who are licensed, who have the experience. So that's definitely one thing. And then you want to talk to your injector and kind of make sure that they're able to answer your questions. You know, they've been doing that stuff like we've mentioned. It's something that they do often. It's not something that, you know, maybe they do like, you know, once every 6 months, for example. Because I know someone was asking, well, and I'm kind of skipping ahead, but we had, you know, someone asking about how important it is to kind of ask for experience and how long that person has been doing it, but also how often they've been doing it. Because if someone did like one procedure like, you know, 6 years ago, and then he's only doing it once a year, you know, that's 6 years, but that's like 6 times as opposed to like someone, like a lot of the procedures that we do here, we're doing it like every day, you know, there's not, we do everything that we've mentioned almost every day, you know, every week. It's not like, oh, we really do cosmetic, but like once in a while we do like a joint injection here and there. No, we do everything. And that's good, because it's not just us, but also it's the staff, it's the front desk, it's the back office. They're all familiar with all the procedures that we're doing because we're doing it so much, and they can help answer your question. They can help make the whole experience a little bit kind of more smooth. So that is also important. As you know, in addition to everything else that she said about making sure the product is right, you understand what you're doing, you understand that different faces will need different products, and you want someone who's knowledgeable to understand that difference, that so they can guide you to and find out what's going to be best for you.
Awesome. So do you guys want to maybe just touch maybe a little bit on that? Maybe just talking about, you know, what products I guess you would use for certain areas. So making sure that your injectors are knowing that, you know, you don't put Botox in an area where there could be filler, or you don't do certain things. And so would that sort of be something that somebody should kind of, you know, look out for maybe, or just kind of take into account, I guess, if people have questions? So do you guys encourage questions like that? I don't know, Karissa, did you want to?
Yes, of course. So yeah, that's why there's a consultation. So if you guys are like hesitant or having second thought which one or which treatment you have to get, for example, you don't know what's the difference of Botox and fillers, that's what we're here for. So if you're having you know, problems with like you know, volume loss, then that's definitely filler. So just give us a call, and then yeah, we'll be glad to answer all your questions about that.
Yes, and so there are areas where you know, it's always Botox. There's areas where it's always fillers, and then there are some areas where it kind of, each injector might have a slightly different style. So as Karissa was kind of saying, you generally for kind of like dynamic wrinkles, when people kind of frown and they get that 11 line, or they raise their forehead, that tends to be more of a Botox treatment. When you're trying to do like fill the volume that we lose under the eyes or in the cheeks or in the lips, that tends to be more fillers. And then again, there are some kind of areas where you can use a little bit of both. There are things like microneedling and PRP, which is more for skin texture. So that's why also, you know, depending on each person's goal, really a consultation is going to be best. So that, you know, you can get an individual recommendation as opposed to, you know, a more kind of generalized recommendation.
So maybe touching on that, so individualized care, like do you know, is it best if like injectors, you know, sort of put you on plans? I know that some of the treatments that we offer here, could, especially with some of our PRP treatments, like it's more of a maintenance thing. So, is it something that for other places, or if they're looking for injectors, should they keep in mind that it's going to be something that's like long lasting, or something that they're going to have to maintain, I guess, should they be asking questions, if they should be kind of coming back, if it's like a one and done situation?
Yeah. No, for sure. And we do a lot. Aging is a process, and it's not something that happens once. It's something that's continuous. So that's why skincare and aesthetics for best results should be a continuous thing. Doesn't mean that you have to be, doing something every week or even every month, but it is something where you wanna keep in mind that you're not gonna do one treatment and then you're gonna be good forever. There are certain treatments that last, longer than other treatments. But generally speaking, especially if you're new, like if you want the best results, you might need, let's say we're talking about fillers, you might need a few more fillers initially, but then as you kind of mentioned, once you get to kind of where you want, then you might only need to do maintenance every once in a while. So we see that pattern in many treatments, like with PRP microneedling, we sometimes recommend that you do 3 treatments or 4 treatments or 2 treatments initially. And then after that, just once a year or once every year and a half, you do a maintenance treatment. Same thing with filler. If someone has never done fillers before and they really want to see a big difference, you might need more than 1 or 2 syringes to kind of get to where you want. So you might need to do a little bit more initially. And you can do that in 1 treatment. You can divide that over 2 or 3 treatments. And then after that, it would be just kind of maintenance here and there. So it would be a lot easier to do.
Awesome. Did you want to touch on anything, Karissa?
Yes, I agree with Dr. A. So again, aging is a process. So we really have to maintain it by, of course, not just by doing aesthetics, but also with good skincare. So we highly recommend those that microneedling to resurface your skin first, and especially if you have a lot of fine lines on your face, and then eventually do the fillers and Botox to kind of maintain it.
Awesome. I know that we just actually got our esthetician services, so would you sort of recommend doing like facials maybe before treatments to kind of, maybe, I don't know, would that be something that would be beneficial?
Of course. And doing facial is really, I love doing facial because it just feels great, to be honest. That's one thing. Like you feel really good. It's just like you've got a deep cleaning to your whole, you feel just refreshed. But it can ready your skin too. It can make your skin, it can help open up your skin so that you can get a little bit more out of your treatment, especially when you're talking about treatments like microneedling and PRP. If you have done the facial before, it's going to make you it's going to prep your skin in a way.
Awesome. I'm trying to think, maybe just, I don't know, just sort of any other just thoughts on people that are just sort of trying to, if this, again, we're trying to just hit, people that have never been here with us, or, what it is that they're, what to expect, or, I don't know, just.
People who are anxious sometimes.
Yeah.
Never had that treatment.
Absolutely.
Honestly, Botox is gets sometimes a bad rap. It's a very old drug that's very well studied and very safe, because we've had a new client actually just a few moments ago, and they were very worried. And one of the most common reactions once we have the clients do the Botox is oh wow, I was worried for nothing, because it's really not a very painful procedure. It's a great procedure. So these treatments are relatively very safe, relatively speaking, procedure. They're effective, and it's good to feel good about yourself, and to look good, and take care of the way you look. Our skin is the first thing other people see when we interact with other people. So I know if you've never had these treatments, there can be some anxiety, and that's understandable whenever you're thinking of doing something new. So that's very understandable. But you come in for a consultation, start with that. Get recommendations that are specific for you, and especially when you come into a facility like this where you're gonna, everybody's here will make you feel comfortable. All the staff here we work with are very great, so I really believe in them, and kind of go from there. Do it one step at a time. You don't have to jump in all in at once. You can just that's why we have consultations for.
Sure. Karissa, did you want to add anything to what Doctor was saying?
Yeah, I
or-
agree. Yeah, so yeah, consultation is very important. So if you're have a lot of questions, especially if you're doing this for the first time, it's very important for us to answer your questions first, and and then we'll recommend whatever treatment is necessary for you.
Sure. Okay. I think that we're just gonna sort of maybe just leave this as an open Q&A for the people that are sort of here. I know that we have a couple questions that were sort of asked. Somebody asked, what is the difference between Sculptra or filler? I don't know whoever wanted to sort of tackle that one.
So a lot of times when we're talking about fillers, the Juvederm and Restylane are the two kind of main companies of fillers here. And then there's also Teoxane that came out recently with the new filler, which is the RHA fillers. But we're usually talking about hyaluronic acid fillers. And these are, fillers that we put in the skin. They give volume. And depending on which filler we use, your body over the next year or 2 years will break down that filler. And that's why the filler will last, for so long on your skin as your body breaks it down. And as your body breaks it down over that year, you kind of lose that volume that the filler gives you. Sculptra is, considered a filler, quote unquote, but it is different. It gives volume, but it does so by simulating your body's own collagen and your own tissue production. So when we use Sculptra, which we commonly use in the face to add more volume and add kind of more that youthful look to the face, because we do lose volume with time, it just works a little bit differently. What it does is that, again, it builds your own tissue, so the volume you get is your own volume as opposed to the filler itself, which is one of the advantages to Sculptra. You do have to be a little bit more patient with Sculptra. The great thing about the hyaluronic acid filler is that you see the results right away. With Sculptra, it can take a few months to really kind of see it build up. But it really also depends on your face and what you're looking for. There are things that we can do with Sculptra that we can't do with other fillers. And there are things that we can do with filler that we can't do with Sculptra. So they both add volume, but they do it differently, and they work slightly differently depending on which area we're trying to do.
Sure. Did you want to add anything?
Yes, it's I agree with Dr. A. It's about the same. So fillers, so it can really minimize the fine lines and adds volume to the treated area. Well, as the Sculptra is actually like a collagen booster. So those are the main differences of the two.
All right, and
we actually have somebody else asking sort of a question. They were sort of wondering, does one syringe would fill about how many areas? So I don't know if you kind of want to go over the syringe maybe
Sure.
amount.
Generally speaking, every area is different, but you're not going to fill more than one area with one syringe. In fact, a lot of times you need more than one syringe per area. This illustration here is just, I don't know how good you guys can see it, but for, one syringe is 1 ml, and 1 ml is really, on its own, it's not tons of volume. You have, I think this is illustrating that 1 teaspoon, and you can see that 1 ml and a teaspoon is really not much. Even the last one is 2 ml, so that would be the volume of 2 syringes. That's the small green spot in a teaspoon. And again, the idea is that it's really 1 ml is not tons of volume. So
Awesome.
yeah, so if depending on the area, like lips, 1 syringe might be enough. Under eyes, a lot of times 1 syringe might be enough. But when you're talking about cheeks or jawline, these are bigger areas. You might need a little bit more volume. Now, even though it's a small volume with 1 syringe, we try to put it strategically in areas where it's gonna show the most. Because sometimes people get discouraged. They're like, oh, it's only that much volume. So we do try to get the most out of it, but we also have to be realistic and not expect that we're gonna be able to lift the whole face with 1 ml of volume.
Sure. Karissa, I don't know if you wanted to sort of just speak about some of the products that we have. I know that somebody had mentioned Juvederm, but that was a Restylane product. Are there differences, or just, I don't know if you wanted to just kind of...
it's pretty much the same, Restylane and Juvederm, so it just depends on what a specific product that we're going to use in a specific area. So yeah, for the example, for the under eye, yeah, we have an option to use Restylane Classic, and then for the for the laugh lines, you can use Restylane Classic, or the Refine or Define. So,
but they're both fillers, basically.
Yeah,
it's
all
just
fillers,
different
hyaluronic acid
products.
that adds
Okay.
volume to those depressed areas.
Awesome. Great. Somebody said thank you for the filler or syringe comment. They were sort of wondering.
Sure.
But I think that's it, unless you guys sort of wanted to add anything else. I don't know, just...
I mean, just to reiterate some of the stuff that we've talked about, first of all, thank you guys for joining us. And yes, if there's any specific questions, the best thing we love these because we get to talk to you guys and answer your questions, but it can be a little bit hard to give individual recommendation because everybody's face is so different. So that's why we always say you might have to do a personalized consultation to see what would work exactly for you, because over here we can talk about some of the general guidelines, general principles, but one product might work great for one person, but for a different person they might need a different product or a different area. Or sometimes people come in and like, oh well, you did my friend's under eyes and they looked great, so I want to do my under eyes, but then we look at them and be like, well, it probably won't look as good in you because you don't have the same issue they've had. For you it would be better to do this line or to do the cheeks, or so just know that the results aren't always, there's a lot of similarities between all of us obviously, but there's also a lot of differences, and you can't always, what we do for one person can always be done to the other person, and what might work for you might be different from a different person. So
Great. Did you want to add anything else, Karissa?
Yeah, so so it's very important to take care of yourself. Overall health. So if you, of course, normal aging is a normal process. So you really have to take care of your skin. And then also, and do this kind of procedure to maintain everything and to feel good about yourself. So yeah, just give us a call, and yeah, we'll be glad to answer all your questions.
And just, I guess, lastly, since we were talking about aging, we kind of mentioned it initially, but we didn't talk too much about it. But like, also part of aging can be the non-cosmetic stuff, which is things like joint pain and things like that can happen with age. And that's, I mentioned initially, PRP is one of my favorite things. So I always have to kind of plug it in and talk a little bit about it. And I felt like we didn't talk enough about it. So I just want to mention that again. Part of aging are, joint pain. It's not a normal part of aging because you shouldn't be like, oh, well, I'm older now, so I should live with my joint pain. But it is something that we see progressing and increasing with time. And it's something to also consider that, yes, we want to look good, but we also want to feel good. So if you're also suffering from things like that, it's not something that you want to ignore. And PRP is a great natural way to boost, to help your body's own healing system kind of work a little bit more efficiently and target specific areas that otherwise can be slow to heal on their own, like joints, because they don't get as much blood supply. So when you cut yourself, your skin heals pretty quickly, but when you injure your joint, it's not as quick to heal because it doesn't have the blood supply. And that's why PRP can be a great option in places like knees, elbows, shoulders, tendons. So yeah, I just wanted to mention that. I know we didn't talk much about it, so but yeah, thank you guys for joining us. We're always here for you if you have any questions, and have a great weekend.
Yeah.